Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Rhonda Bryant. You are from the Wicomico County Health Department.
Yes.
You are the Coordinator of Community Services and the Tobacco Program Coordinator.
Yes.
So the perfect guest to discuss a very important and timely topic, smoking, which has been around for a long time. And then, of course, we're going to also discuss e-cigarettes, which are a fairly new phenomenon.
Yes.
So let's first talk about smoking, cigarettes, that is. Tell us about, obviously, the dangers of cigarettes.
First of all, right now, smoking is down. But the dangers of cigarettes are that cigarettes can harm mostly every part of your body. You can get lung cancer, you can get throat cancer, cervical cancer. Pretty much every part of your body you can get cancer. Over 480,000 people die every year from smoking-related illnesses, such as cancer.
Yeah, I know you said it was down a little bit, but still 15% of adults in the U.S. smoke, according to the CDC. And of course, what's the rate in Wicomico County? It's a little higher.
Yes, the rate in Wicomico County is 19%. And it's not only just smoking, there's others. We have e-cigarettes, and that's probably one of the reasons why smoking is up in Wicomico County.
We'll talk about that later,
Okay.
how e-cigarettes has not deterred smoking. It
Yes.
seems to have increased it. But of course, I think most people have heard that smoking is the leading cause of preventable death in the U.S.
Yes.
Costs billions of dollars each year in healthcare costs for all these various things. I know when I talk to my students, we talk about emphysema. Almost everyone that smokes and continues to smoke will develop emphysema or COPD later in life, and that's a terminal condition. There's no cure. And then it's associated with many, many other things, including heart disease. I have some statistics. It increases coronary heart disease by 2 to 4 times, stroke, 2 to 4 times, and statistically, lung cancer, 25 times greater risk of lung cancer if you smoke.
Yes. And also something that people don't relate to smoking is diabetes. A person that has diabetes, more than likely, their insulin levels will be higher than average because of the fact that they're smokers.
And of course, we wanted to mention how many chemicals there are in cigarettes, in addition to nicotine, which is highly addicting, of course. Tell us about the chemicals in a cigarette.
From right now, from the count now that we know of, there's over 4,700 chemicals in one cigarette, which other than the nicotine, we also have formaldehyde, which is used to preserve dead bodies. We have arsenic, which is used in rat poison. And some of the most dangerous chemicals, mainly household chemicals that we use every day, are in cigarettes.
Let's talk a little bit about some of the tremendous inroads we've made in understanding smoking in terms of it being a very strong physical addiction. There's been lots of research about how it acts on the brain.
Yes, usually when a person smokes, it goes to their lungs, and then from their lungs, it can go to their brain, because when a person smokes, it releases like a pleasure principle, such as dopamine. And so once a person smokes and they get that pleasure, they feel like they need to continue to smoke, which also leads to that nicotine addiction.
And it's very strong.
Yes,
very,
very strong.
And we'll talk later about some of the ways the health department can assist people in quitting.
Okay.
And it's usually not successful the first time around because of the strong addiction. And it's also a habit. You know, people just get into the habit of doing it, and it's tough. So we'll address that later. So we know there's over 75 different illnesses, conditions, and so on that are caused by cigarette smoking. Now, where are we in understanding e-cigarettes? How long have they been around, and what exactly is an e-cigarette?
Okay. E-cigarettes have been around since 2007. They were originated in China, and then they came to the United States. And the tobacco companies, they wanted a new way to a new way to actually get the attention of teens. So we look at it as the tobacco companies targeting the teens with the e-cigarettes, with the flavors, the really fancy e-cigarettes, the different types of e-cigarettes. And right now, it's like it's the in thing for teens.
Yeah, especially when you add flavors to the mix.
Yes.
I know, that's one of the
Yes.
major issues people have is the targeting of children. And of course, we know a lot of teens pick up cigarette smoking, and they get addicted very early, and it's just very hard to quit once you go a few years into it.
Yes.
The one thing I wanted to mention, because I learned this myself reviewing this, is ENDS. It's an acronym for Electronic Nicotine Delivery Systems.
Yes.
And that includes e-cigarettes, e-pens, e-pipes, and they even have e-hookah systems.
Yes.
So I guess there's a variety of ways people can...
Yes, there's a variety of ways because like I stated, all this is to get the attention of teens. So they didn't want to, the tobacco companies didn't want to just stop at one thing. They wanted to use different type of electronical things for the teens.
Now tell us exactly what's in an e-cigarette or how it's put together. I know there's a cartridge that it's a mixture with nicotine.
Yes.
That's where the nicotine resides?
Yes, there's a cartridge that has nicotine, and then there's also, it depends on which e-cigarette the person has. There's some that has a little battery, and if you've heard on the news, sometimes the things about the batteries exploding is where once the person smokes the e-cigarette, all that turns into the battery heats up the liquid. So once that liquid is heated, it's hard to determine, like the outcome of what is actually going on the inside, because for a while there was no instructions with some e-cigarettes. So when you hear it on news, they say it's always human error because there weren't instructions to some of the e-cigarettes.
So you have the cartridge and the battery, and then of course the casing.
Yes, the casing.
It creates a vapor.
Yes,
that's why they call it vaping.
Yes, and it creates a vaping. But then there's some that has a bigger cartridge that you sit the actual e-cigarette in, that houses the battery and the liquid.
So they've come up with different ways.
Yes.
Now, what are the major chemicals in an e-cigarette, in addition to the nicotine, which we know is badly addictive?
Yes. Some of the most harmful chemicals, one is benzene, which is used in our gasoline. One is diethylene glycol, which is used in antifreeze. One is also formaldehyde, which is used to embalm dead bodies. That's one of the addictive chemicals that's also in a cigarette. Then we have isoprene, which is used in synthetic rubber. And the last one, like I said, is the nicotine, which is a very addictive drug.
Now, I remember when e-cigarettes came out. I didn't realize it was 2007. They've been around for 10 years already. I knew from the start it wasn't a good idea, but they were marketed to say that they would help you smoke because of that feeling, of the vaping feeling, downplaying the nicotine in there. And of course, it does have less chemicals than an actual cigarette.
Yes.
But at the same time, is it really safer? I think we're finding out more and more it's not that safe.
Yes. Right now, from what we know, it's not a safe alternative to smoking actual cigarettes. One thing, it could be more dangerous because e-cigarettes have nicotine levels. It could be from a 2 on up to a 10. A person that's so used to smoking actual cigarettes, they need to get that nicotine fix. So if they use e-cigarettes, they're going to have to smoke more of the e-cigarette to get that nicotine fix because of the fact that the levels. There's only certain levels to an e-cigarette. So they're gonna. I've heard of people that smoke their e-cigarette all day, every day, because they're trying to get the same nicotine fix that they were getting from actual cigarettes.
So it's not really helping people quit.
No.
People get started on them and get actually addicted to the e-cigarettes.
Yes.
So I guess because of this, and the FDA and the Surgeon General have come out and made some statements about e-cigarettes. So what's going on in that regard with regards to the regulation of e-cigarettes?
Last year, August 2016, the Food and Drug Administration, they won a suit saying that they could regulate e-cigarettes because they want to try to make it so teens don't buy them. So what they did, now you have to be 18 to purchase tobacco products. Now, usually we would say cigarettes, but now it's called tobacco products, any form of tobacco, whether it be cigarettes, whether it be e-cigarettes, whether it be the e-liquid. Yes, the smokeless tobacco also. So now regulations say that you have to be 18. Tobacco companies or retailers aren't allowed to give out free samples. And also, teens aren't allowed to just go to, like before you could go to different vape shops and just sit there and smoke e-cigarettes. But now it's against the law, because one thing that we found that when the teens would go there, that was an easy way to get them addicted, because they were able to sample the e-liquid flavors.
Have all the flavors, yeah. And I know right now they're not required to put any kind of labels on their product, or they can say it can help you quit, but now they have to bring some evidence forward.
Yes. The Food and Drug Administration gave the tobacco companies 2 years to prove that e-cigarettes could be used as an alternative to smoking, and not only that, it also gave them a chance to prove that e-cigarettes are actually safe to use, because right now we don't know. We don't really know. We know some things, but a lot of tests and studies are still being done. But one thing we do know now is the fact that e-cigarettes are related to secondhand cigarette smoke, which with secondhand cigarette smoke, over 57,000 people die every year, and many of them were non-smokers. And secondhand cigarette smoke is called mainstream smoke, where if a person's smoking, it's the smoke that that person blows out. And when the smoker blows out those the secondhand smoke, there's actually over 7,000 chemicals in secondhand smoke. So
7,000?
Over 7,000, yes. The person that's smoking is taking in 4,700, but once the smoke hits the air, other chemicals connect with the 4,700 chemicals, and then that leads it to 7,000 chemicals.
So it's as dangerous, if not more.
That's why so many people die.
Yeah, I know. It takes a while to collect all this data,
Yes.
and that's why they can get away with it.
Yes,
they
that's
put out a new
true.
product, and there's new data, so you can't say it's not safe until
true.
you have the evidence to
That's
show.
true.
So I guess we're quickly amassing some evidence to
Yes.
show the short-term and long-term negative impact.
That's true.
So let's now talk about where the health department comes into play. And I guess before we get into specifically what the health department has to offer in terms of quitting strategies and support, what are the general strategies that are used to quit smoking?
Okay, some of the general strategies, which quitting cold turkey is the best alternative you can have to quitting. We also offer smoking cessation aids, which are also called nicotine replacement therapy aids. We offer the Nicoderm patch, the Lozenger mints, and we also offer Chantix, which Chantix has pretty much been the most effective out of the 4 or the 3. Chantix is it's a pill. Unlike the rest of the smoking aids, it's a type of pill that a person uses to help them with their quitting process.
The only problem is with Chantix, I know you see it advertised quite a bit, and they
Yes.
mention it can have
Yes,
some
it does have
side effects
yes.
in a small percentage of people,
Yes.
but it is very effective.
Very effective. Yes.
I know there's another medicine called Zyban. Have you?
Yes.
You don't make that available.
No, we don't.
Chantix is
Yes.
actually very effective,
Yes.
and that's what you offer. Getting back, how effective is the Nicoderm? I know these can be helpful.
Yes. The Nicoderm patch is very helpful. What I try to explain to all the participants is what your body chemistry will work with. Some people, like I said, Chantix is good for. The patch, some people is really great for. I've had many people quit on the patch, and same with the lozenger. And we also give, like if someone starts on one smoking aid and it's not helpful to them, we do allow them to switch to a
Are these
different
available
one.
at no charge? Or?
They're available at no charge.
That's good.
Yes.
I know a lot of people try cold turkey because it
Yes.
doesn't cost anything, but I
Yes.
think a lot of the evidence is showing it's
Yes.
very hard to quit cold turkey
Yes.
and sustain that.
Yes, and one of the reasons why I think that is many people that quit cold turkey, or they're trying to quit without the education and the support. And I explain to everyone that comes to my group that you have to still continue to come to get the education and support. So it's just using a smoking aid is just not going to be enough.
Yeah, I know all the research says you have to try many modes
Yes.
of support, plus either Nicoderm or Chantix, or I mean, that doesn't mean that some people can't quit cold turkey.
Yes.
But I think you also have to substitute something for the habit of smoking.
Yes,
you know,
that's true.
When you have your coffee or a drink, or you got to be doing something else.
Yes, I try to teach them also to recognize the triggers. The holidays, that's like one of the biggest triggers. And also the hand to mouth. We try to teach them to do something different with their hands instead of the hand to mouth, because some people have smoked for over 30 and 40 years. So that's something they've done for years. So just getting out of that habit of their hand going to their mouth to smoke the cigarette.
And all the research says it's never too late to quit,
Yes,
and it
that's
may
true.
take several attempts. You just have to stick with it,
Yes.
you know, and may take 3, 4, 5 times. And the longer you smoke, the harder it is, because your
Yeah.
brain gets hardwired.
That's true.
So tell us also about your education support programs through the health department that people can access at no charge.
Yes. I'm at the health department every Thursday. I hold a smoking cessation group on the 4th floor of the Hurdle building, which is on Main Street, 108 East Main Street.
Downtown.
Yes, Salisbury, Maryland. During that time, we start with education, support, and then at the end of each class, which is only an hour from 12 to 1, I offer the smoking aid, which is the Chantix, the patch, or the lozenger. I have people that have quit smoking a year ago, and they still attend the classes faithfully every Thursday because they still want to continue for the education and support.
Well, it reminds me about alcohol use. You know, you keep going to
Exactly.
AA meetings
Yes.
to kind of keep the faith, so to speak.
Yes.
Stay with the program. So, Rhonda, you do programs on the premises of the health department, but you'll also take your programs out.
Yes, we do. I do smoking cessation classes out in the community. We have little flyers that we distribute to different organizations, and if they're interested in having me come there, even if it's just for a presentation or smoking cessation classes, I will contact them, and then I'll set a date to go and do 10-week smoking cessation classes, which is very successful also, because they get the same thing as my noon class, but it's only in 10 weeks. They get the education, they get the support, and they also get the smoking aids free of charge. So I do that a lot.
Well, I imagine some employers would be interested in that too,
Yes.
because smoking is linked with illnesses and
Yes.
more likely to get colds and flus and pneumonias,
Yes.
and saves work time overall. Do you take the jar of tar on tour with you? I know you have a famous jar of tar as a
Yes,
visual aid.
Yes. When I do the part on smokeless tobacco, I usually take the jar of tar, also the mouth, we call it the yuck mouth, where you can actually see the different sores that can develop in your mouth and how your teeth, how they actually deteriorate from smoking.
The teeth and the skin, it
Yes.
leads to accelerated wrinkling. It has
Yes.
other problems associated with as well.
Yes.
Now, do you have special programs, say, for teenagers that maybe have started and then they're young adults now and they want to stop?
Right now, what I do is the schools have a no policy for tobacco. They have a policy, a smoking tobacco policy in place for teens where they're not allowed to smoke any form of tobacco product on school property. So when the teens are caught with the tobacco product on school property, they're referred to us at the health department, and their parents call and set a date for the teen to come to meet with me. And when the teen comes to meet with me, I do one-on-one counseling with them, because where they're under 18, I can't offer the smoking aid, but I can offer support and education. So what I usually do, I educate them on whatever they were caught with in school. If it was a vape pen, I educate them on vape, and then I also tell them about the dangers of smoking and how it might not affect them right now, but as the years go by, it will eventually start to affect them. And so then we give them a project that they have to do, where they have to turn it in 14 days. And when they bring the project back, they also have to come and explain to us what they actually learned about e-cigarettes or whatever tobacco product they were caught with.
Well, that just seems like such a different animal where you're trying to educate. I think once they start, if they have that peer pressure,
Yes, that's
you know,
true.
and if your parents smoke, you're more likely to smoke.
Yes.
So our parents have to be better role models if they
Yes,
can.
that's
And
true.
I just think it's interesting that, you know, they want to be independent and exert their independence and smoke and do what they want to do, yet the nicotine and such is taking control
Yes.
and actually affects that.
Yes.
But it's tough. It's a very hard addiction. They need a lot of education and
They
support.
do.
And
They
that's where the
do.
health department
Yes.
comes in.
And I go to the schools also.
Do you?
Yes, I try to go to all the schools in Wicomico County, and I take my board, and I educate them on the dangers of e-cigarettes, since that's the biggest fad going right now.
Well, hopefully if you can impact even a few people, to me that's a huge
Yes,
difference.
that's true.
So that's just wonderful work you're doing with
Thank
the health
you.
department. And I appreciate you coming on to the program to share
Thank
your knowledge and what programs you have available to help people that are trying to quit either smoking or e-cigarette products.
you. Okay, thank you.
And we'll put up some websites at the end of the program where people can get more information, including information of, at the health department, the website, and the phone number they can call to get more information.
Okay, thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.